So the reflex here we're going to be doing is called the tendon guard reflex. This is a reflex that gets integrated around 2 or 3 years of age. It's a reflex that normally when it's present, the baby will pull its foot away from this stimulus. So the stimulus looks like this. This is an adult that doesn't have the reflex, and this is a normal response where if I just stroke in there, nothing happens. If your child was retaining this reflex, it would look something like this. So they would stroke it, and then we'd be pulling the foot away. So some of the problems if this reflex is retained is that every time they're walking on the ground, their foot has the tendency to do this, so they end up they'll walk on the outside of their feet very often. Some of the other consequences are that a lot of their joints just might be stiff because there isn't fluidity in the foot, and this can actually have implications in a lot of other things too, even bedwetting, difficulty handling stress in life, and a number of other problems that can come with that. There's also a reflex we test where it's called the Babinski, where I would do this kind of stroking like this on the inside of the foot, and sometimes the toe would go up. In a baby that's okay, but after that gets integrated, it should kind of come down in an adult. So if you think of it when you're walking on the ground, you want your big toe to be grabbing the ground. If every time the child puts his foot on the ground, the toe goes up, mechanics go funny when they're walking. They'll actually change their foot around to make so they either will be walking in a funny way or they'll be hitting the foot in a weird way, and it causes a lot of different problems. So in order to integrate this reflex or help the child get over it, basically the first thing you're going to do, we can do this in a number of different steps. So the first part is just on these two different parts here, on the ball of the foot here and on the inside of the arch here, you're just going to